Hi, my name is Cindy Bowe. I am Senior Vice President and Chief Strategy Officer for Boston Medical Center Health System. My main responsibilities as Chief Strategy Officer at BMC is to be able to do a couple of things. Number one is to design different programs on the clinical care delivery side to ensure that there's access and equity. The second thing is to build out networks and partnerships so that we can allow for better access points for our patients and communities. And the third thing is to constantly think about innovative ways to be able to provide care as well as partner on some really just fundamental things that we can do. So for example, the intersection of healthcare and sustainability. So the Innovation Office is set up this year in 2024, and we have two prongs. The first prong is to be able to solicit the information and ideas from within. We believe that if BMC has proven to do something successfully, then we're able to commercialize and market it to the public. It's almost thinking about democratizing some of that information or the tools so that we can better healthcare at large. That's really a mission of ours as part of innovation. The other thing is that we know we can't do it alone. So whether it is partnering with a different company to be able to do that, or to be able to think about what each member or party or partner brings to the table so that we can create something that is a solution for a known need. I think the one thing is not to create a solution and then find the problem, but to really go at the problem and find and develop a solution that makes sense for the market that will allow our innovation office to really succeed. So again, it's internally looking at which ideas that we've done and have proven to ourselves based on evidence. And then the other one is to think about what other innovations there are with partners, because we can't do it alone. And sometimes we don't want to do it alone. We want to be able to work with our partners to engender something even bigger, better, that truly addresses the need of our markets. I think some of the innovative trends that we're already seeing is how do we create those advanced therapeutics for our patients. But more importantly than just being able to create those therapeutics is how do we get those therapeutics so that we can actually influence and impact our patient population. So there's oftentimes a notion of, being able to get the advanced therapeutics like cell and gene therapy for sickle cell. But I think the more important thing is how do we diagnose and find those patients who have sickle cell? How do we then engender their trust to be able to have BMC cover and care for them? And then finally, as an alternative to getting better, introducing the therapeutics to them so that they can enroll in either clinical trials or be a patient who is receiving some of these therapeutics. Finally, I think it's important to not only think about the therapeutic piece of it, but also to think about the continuum of care. Many of our patients are underserved, so in addition to finding and seeking care delivery, they may have other social determinants of health that we need to factor in. Things like transportation or energy or food insecurity barriers that are really critical in order to help them heal as a patient. And then other innovations that we are trying to look at is constantly figuring out how to performance improve on a day-to-day. We hold ourselves to a very high bar. So even on the daily operations of delivering care, we have different ways of constantly improving upon those processes. And of course, in the pure sort of sense of innovation, it's really thinking about what partnerships or what new companies that we can launch. BMC has had a very successful track record. For example, we've launched Clearway, which is a specialty pharmacy company over the past couple of years. We are now looking at a different approach to building innovations by setting up an innovation office that we now have, and looking at which investments or which bets that would help further the frontier of healthcare. As I mentioned, I think one of them could be the intersection between sustainability and healthcare. Being very clear-minded about what the mission is. So it has to be, in healthcare in particular, really trying to improve the lives of our patients and members of the community. there are so many different solutions in the marketplace. Everybody is creating a new technology platform, a new service, a new offering. But ultimately, when we think about from the BMC lens of who to partner with, it is who ultimately can help prove the fact that we are solving a member or a patient's problem, and then if we can demonstrate the impact of that. I think it's really important for companies or new entrepreneurs to really think about it from that lens. There are so many other different lenses you can think about it, for example, financial or otherwise. But I think going back to patient care, patient outcomes, improving the lives of patients, that's a core principle that would be very attractive to any health system, because we're all trying to get there together. So if a partner is able to come up with that, or an entrepreneur is able to come up with that, that would be a much more compelling reason to be able to partner.